I'm Emily Sane. This is my husband John and our baby Rylan. Had him at 8:10 Sunday night. He weighed 7 pounds 13 ounces and was 20 inches long. It's been wonderful having a baby at Cleveland, and all the nurses have been amazing here. They've checked on us constantly, given us anything that we needed. It's just been a really wonderful experience for us.
When a woman comes here to have her baby, she will be greeted with friendly faces, highly trained women who are competent in what they do. The rooms have your bed, you each have your own bathroom, there is a place for your significant other to stay with you. The patients here, they're here to have a special day. It's their birth of their baby. They're very concerned sometimes when they get here, and it's our job to make them feel comfortable, to make them feel easy and like they're just at home.
Most everybody in the community feels like they can come here and trust the people that they are being cared for by. I think there are several reasons they trust. One is because their families have been coming here for generations. Two is because it is a small community hospital. A lot of the staff live in the community and know a lot of the people in the community. They're either family related, or they go to church with them, or their spouses work with someone else's spouses. And so I think it's nice to come to a hospital where you feel like you see familiar faces and you know who's going to be there taking care of you.
The reason why you should have your baby here is we're like family. I had my baby here 3.5 years ago, and I would have to say it was the best experience ever.
I think we've got the greatest job. We'll see toddlers and teenagers in Walmart and their parents remember us, and it makes us feel good that we were part of such a special time for them.
It's a privilege to let them allow us to be there in that special time.
Oh, I would try to convince anybody to come to Cleveland. The doctors have been wonderful here. The hospital is great. It's just been such a good experience for us. I wouldn't recommend anywhere else. This room is very big. It's one of the suites and has the couch with the bed and table. There's been plenty of room when our family come to visit. I mean, it's really nice. I was not expecting it at all. The labor and delivery room was really big too.
We have 8 LDR rooms in our labor and delivery unit where our moms labor and deliver and recover. We also have our own OR suite where we do all of our C-sections. All of our labor and delivery staff are trained and competent to assist the physician with C-sections. And then once mom is fully recovered from her delivery process, we move out to the OB unit where we have 19 rooms available. 6 of those are our OB suites, and they are kind of like a double room where we have a nice sleeper sofa for dads to sleep in, and 2 bathrooms, a his and hers bathroom, which is nice to have, and then plenty of room for family to come and visit as well. And those are available upon delivery as long as we have one open.
We are a small hospital, but it's more like a home where you're not a number here, you're a patient. We'll know you by name, get real personal with you, one-on-one, patient-centered care.
I think we have a wonderful group of doctors, midwives, nurses, both in our office and in the hospital, that would provide excellent care. But having a pediatric hospitalist is a wonderful asset to our facility. These are board-certified pediatricians and board-eligible pediatricians that are in-house and working for a week at a time, so that we have a pediatrician available when we need them.
We're small enough to offer that family feel, and we're large enough to have the modern and up-to-date research-based, evidence-based practice.
Immediately after the birth, we put the baby directly to the mom's chest. As long as the baby is stable, we leave the baby with mom as long as possible so that they can bond. And pretty much the baby will stay with mom throughout her entire transition. Even if she has a C-section, we keep the babies in the OR with mom, and as soon as mom gets in the recovery room, we put that baby to her skin directly there also.
The reward I get out of working on Women and Children's is I've just helped a family bring a human being into the world. I have been one of the first few people that they've come in contact with to teach them how to take care of the baby, take care of themselves.
Even though I had worked here, I had the option to choose where I wanted to have my child. The doctors we work with are amazing. I've never worked with any better doctors, and the nurses are the true heart of the unit. They carry us along, and I couldn't think of anybody better to bring my child into the world with.
We bring every patient in as if they were our own sister, mother, daughter, and we provide care for our patients as if they were our own family. We work very well together as a team, not only between the nursing staff, but with the physicians as well, to make sure that we are always on top of everything that's going on with that patient.
What other job you can do that you see a miracle every day? And I still see every one of them as a miracle.
Really, the staff here has been so wonderful. Every doctor we've met has been really nice. They've been really quick to answer our questions that we've had. I can't imagine another hospital to have a better staff of doctors and nurses.